Salmonella, primary intestinal parasite of vertebrate and which infect man, leading to enteric fever, gastroenteritis, and septicemia. The most important member is Salmonella typhi, the causative agent of typhoid fever. Man is the only natural host for Salmonella typhi and Salmonella paratyphi, whereas most of the other Salmonella are chiefly pathogenic in animals like poultry, pigs, cattle, etc. Salmonella are gram-negative bacilli measuring 1 to 3 micrometer into 0.5 micrometer. They are motile, non-sporing, and non-capsulated. The Salmonella grows on ordinary medium culture medium at optimum temperature of 37 degrees centigrade. They are aerobic and facultative anaerobic. They produces colonies of 2 to 3 millimeter in diameter, circular, translucent, low convex, and smooth on mechanic agar and deoxycholate citrate agar. The colonies are colorless due to non-lactose fermentation. On Wilson and Blair bismuth sulfide medium, selective medium for Salmonella, jet black colonies with metallic sheen are formed due to the formation of hydrogen sulfate. Salmonella paratyphi and other species which do not form H2S production green color colonies. Xylose lysine deoxycholate agar is another XLD agar is another medium used for isolation of these organisms. The most strains of the Salmonella produce red colonies with black center when grows on this medium. H2S negative serotype of Salmonella produces red colonies without black center. The selenite F broth and tetrathionate broth (TTB) are commonly used enrichment media for inoculation of specimen, especially feces. Biochemical reactions of Salmonella typhi and Salmonella paratyphi are shown. Antigenic bi- biochemical reactions of Salmonella typhi and Salmonella paratyphi. Salmonella typhi, glucose positive, mannitol positive, lactose, sucrose citrate negative, MR positive, VP negative, H2S positive. Salmonella paratyphi glucose weakly positive, mannitol weakly positive, lactose, sucrose citrate negative, MR positive, VP negative, and H2S negative. Salmonella paratyphi B, glucose weakly positive, mannitol weakly positive, lactose, sucrose negative, citrate positive, MR positive, VP positive, and H2S positive. Salmonella paratyphi C, glucose weakly positive, acidic and gas, mannitol வந்து acidic and gas, lactose sucrose negative, citrate positive, MR positive, VP negative, and H2S positive. The antigenic structure: flagella or H antigen phase 1, phase 2, somatic or O antigen, surface or VA antigen. Cellular location of a flagellar, somatic, and surface antigen are shown in the figure. The phase 2 variations, antigenic variations, HO variation, 2 phase 2 variation, 3 VW variations, and 4 SR variations. Kaufman's white scheme. It forms the basis of serotype of Salmonella based on the identification of O and H antigen by agglutination. The Salmonella are classified into groups based on distinctive O antigen factors. The distinctive factor for the group A is 2, for group B 4, and for group D 9. Within each group, further identification and differentiation is by phase 1 and phase 2 flagellar H and M antigen. Disease: Salmonella typhi, Salmonella paratyphi A, and usually Salmonella paratyphi B are confined to human beings. The majority of other Salmonella are primary infective from animals and human beings and are secondary infected. Salmonella causes 3 types of clinical symptoms in human beings, such as enteric fever, typhoid fever, Salmonella typhi, paratyphoid fever, Salmonella paratyphi A, B, C. Septicemia, commonly caused by Salmonella cholera suis and Salmonella paratyphi C. The gastroenteritis commonly causes Salmonella typhimurium, Salmonella enteritis, Salmonella Newport. Epidemiology: the enteric fever is endemic in all parts of the India. The typhoid fever is commoner than paratyphoid fever. Salmonella paratyphi is prevalent in India. Salmonella paratyphi is rare and C very rare. Enteric fever occurs at all ages, but it probably most common in 50 to 20 years years age group. The feces of carrier are very important source of contamination of food and drink rather than the frank clinical cases. Mary Malone, typhoid Mary, a cook in USA was famous carrier who causes a severe outbreak over a period of 15 years. Laboratory diagnosis. The bacteriological diagnosis of enteric fever consists of isolation of bacilli, demonstration of antibodies, demonstrations of circulating antigen, isolation of bacilli. This may be done by culture of specimen like blood, feces, urine, aspirated duodenal fluid. The selection of relevant specimen depends upon the duration of illness, which is very important for the laboratory diagnosis of enteric fever. Mm. The relevance of examination of different specimens at different phases of entry fever. Duration of disease first week. Specimen examination blood culture 90% positivity. Second week blood culture feces culture viral test is 75% 50% low titer viral test low titer. Third week viral test 80 to 100 percentage, blood culture 60%, feces culture 80% positive. Clot culture is an alternative to blood culture. On McConkey agar or DCA, deoxycholic agar, the salmonella grows as a pale yellow non-lactose fermenting colonies. The gram staining from these colonies shows gram-negative bacilli, and on hanging drop preparations, these are motile bacilli. The species of salmonella can be differentiated by biochemical reactions. A slight relation with O and H antigen confirms this specimen species. Demonstration of antibody viral test. It is an agglutination test for detection of agglutinin H and O in patients with enteric fever. The salmonella antibody starts appearing in the serum at the end of the first week and rise sharply during the third week of enteric fever. Two specimens of serum at an interval of 7 to 10 days are preferred to demonstrate a rising antibody titer. Other serological tests, ELISA, indirect hemagglutination test, and CIEP, demonstration of circulating antigen. The typhoid bacilli antigen are present in blood and urine. The antigen can be detected by co-agglutination, CIEP, and ELISA treatment. The chloramphenicol has been the antibiotic of choice for enteric fever. Resistance of chloramphenicol and other antibiotics have been reported. R factor carrying multiple drug resistance have become widely disseminated among the salmonella. Fluoroquinolones, ciprofloxacin, pefloxacin, ofloxacin, and the third generation cephalosporin, ceftazidime, cefotoxim, ceftriaxone, cefoperazone are useful in such multi-resistant cases. Prophylaxis, proper disposal of sewage, clean water supply, supervision of food process and handling. Infected meat and egg should be thoroughly cooked. Carriers, the carriers should not be engaged in food preparation and should be observed strict personal hygiene. Vaccine is indicated the travelers or who lives in endemic area. TAB vaccine, heat killed whole cell vaccine, which contains Salmonella typhi, 1,000 millions of Salmonella paratyphi A and B, 750 million each per ml, and prevented in 0.5% phenol. The vaccine is given subcutaneously in two doses of 0.5 ml of at an interval of 4 to 6 weeks, followed by the booster even 3 years. In India, a divalent vaccine containing Salmonella typhi and paratyphi A is now used. The live oral typhoid vaccine, a virulent mutant strain of Salmonella typhi 21A, lacking the enzyme UDP galactose 4 epimerase gal-E mutant, has been used as a live oral vaccine. 3 doses are given on alternate days. The oral vaccine Typhoral is available in capsule forms containing 10 to the power of 9 viable lifeless mutant bacilli. Purified VI polysaccharide vaccines, Typhim VI. It contains purified VI antigen. It is injected intramuscularly in a single dose of 25 microgram.